Hello and welcome to our very first episode of Let's Chat. I'm here at Nevada County Media with Maggie Philipsborn from the Nevada County Cannabis Alliance, and we're going to learn a little bit about that today. Welcome, Maggie.
Such a pleasure to be here with you, Valerie.
Thank you, likewise. So before we start talking about you, let's talk about Nevada County Cannabis Alliance. Tell me, when was it founded and why?
The Nevada County Cannabis Alliance was first started in 2016, and it was founded as a local nonprofit policy and advocacy organization. At the time, there was a ballot measure, some folks might remember as Measure W, that was an attempt to, when Prop 64 passed statewide in California, local jurisdictions got to make their own decisions as to whether they wanted to allow permitting programs and access to licensure for legal cannabis businesses. And Measure W was a attempt back then to ban all commercial cannabis cultivation in the county. And so a whole wonderful, diverse realm of local activists and community members got together and defeated Measure W, and sort of was the beginning of a really wonderful movement here in Nevada County. And the Nevada County Cannabis Alliance has been going strong ever since, and still works on local advocacy and policy and education work for the local cannabis industry.
Well, that's incredible. So what is your most pressing concern now? What are you guys really focusing on at this moment?
Yeah, so much has changed since then. The cannabis industry is really quite a wild new venture for the state of California, and the statewide regulatory system is very challenging and still changing and in development on the state's end of thing. And what we are really focused on is helping small farm and small businesses in general survive right now. It's a very challenging market. The price of cannabis has plummeted, and it's just a very expensive and difficult environment to create and start a business. And so we do a lot of education on business skill developments, sustainable agricultural practices, and are constantly doing advocacy and policy work to make it a viable regulatory system for small businesses to exist and thrive in.
Yes, I know that when it passed, the recreational bill in California, the number escapes me.
Prop 64.
Prop 64. When Prop 64 passed, there was a big concern in the cannabis community and in the community at large that the giant corporations were going to take over, and that's a very valid concern.
Yeah.
Because we've seen that happen in like everything.
Yeah.
And so I remember there was talk, and I'm guessing there's still talk about making Nevada County a craft cannabis location, kind of like some people like Budweiser, some people like Sierra Nevada, some people like Grass Valley Brewing Company, or microbrewery beer. And so the same thing could be said for cannabis, right? And I know that with the regulations, that's been very difficult, but do you see a path forward where Nevada County could be its own brand of specialty craft cannabis?
That is absolutely what we're striving for. 100%. That is the vision that we are working towards, that we are making sure that policy provides a pathway towards, and that's absolutely the vision we want to see. It's a very young industry still, and we make comparisons to the craft brewery industries, and just sort of any industry like that, the wine industry and so forth. And it's going to be a while for all of the market turbulation to smooth out and to really, there's so much consumer education that comes along with why people choose craft beers, and why people shop local. We very much think that cannabis is a incredibly important economic driver for our small, more rural region here in California. And there's so many ways to have it be sort of continue to be the multiplier effect and really uplift all of our other local industries. And people in Nevada County, we really pride ourselves on not having a lot of big businesses here and really supporting small businesses and entrepreneurs and, local farms and various things of that nature. And cannabis can fit in perfectly with all of that, as well as increase all of those other industries and small businesses along with it.
The rising tide lifts all boats
theory,
which is,
I love that statement.
I love it too. So tell me a little bit about the Cannabis Alliance. We established that it started in 2016, but I know that you've grown and you guys have done all of your work. How many members do you have now?
Yeah, we have around 200 members. So we are a member-based organization, and our membership is made up of the license holders, so all of the local legal cannabis operators, as well as people seeking licenses and permitting, as well as ancillary businesses and any other businesses who work with the cannabis industry or otherwise who want to support the work of the Alliance. And yeah, we do year-round education that is helping people through the permitting programs, helping people with business development skills, regulatory concerns, and just other industry going-ons. As well as we have a really wonderful compassion program. We just had our first ever compassionate care event at the local dispensary in Nevada City, which was amazing. And just doing continued community education, which, as you know, is it's a lifelong journey. And, just educating people about small craft cannabis and why it's important to have legal access to legal retail for consumers, and why it's so important to support small, sustainable cannabis farmers.
Yes, because that is something that the illegal grows, that's something that the opposition has mentioned many times, is like the illegal growers are stealing water, they're putting pesticides into the waterways and taking over like areas of public land. And that is absolutely a valid concern, and I know that that's something that the Cannabis Alliance has been educating people not to do. But what is the official stance on that black market that is still happening? What is the position of the Cannabis Alliance about those issues?
Yeah, this obviously it's a very hot topic throughout the community. We spend a lot of time educating elected officials about this also, and just we are community members here too. We are all environmentalists. We don't want to see our local rivers and any part of the environment, degraded in any fashion. There is a huge difference between small homestead cannabis farmers and what we see happening on public lands and in the news and so forth. And it's really important to differentiate those two things. And so we spend a lot of time educating around that. And our members and our organization is about industry responsibility and environmental stewardship. And so that is what we preach, and we walk the talk in that regard. And we have members that are OCal certified, which is the California organic equivalence for cannabis, Sun and Earth certified, which is a wonderful third-party certification, that really just touts sustainable regenerative farming practices. And so our membership really, we are very proud of the work that they do, and think that they're really wonderful examples for the community to see of what the difference is regarding that.
Something that you mentioned earlier was the compassionate care program, and I know Wade Laughter is like the grandfather of CBD and such an amazing, wonderful person who has done so much for that cause, for cannabis's wellness. So I've heard the not really complaint, but I've heard it discussed that as retail became legal, the cannabis as medicine kind of got lost in the shuffle, as it's wont to do, because you have this many people that need cannabis for health reasons, and like this many people that want cannabis for like their Friday night woo. So is the Cannabis Alliance, it sounds like that you are, because I know that Wade, I believe, is one of your board members. How are you promoting, besides that wonderful event, cannabis as a wellness
Sure.
drug? I don't want to say drug, as an alternative medicine.
Absolutely. Yeah. No, I appreciate that. So members of ours formed a compassion committee. Wade Laughter is a part of that. Him and his wife Monica, they started House of Harlequin and do really wonderful cannabis education, both on through House of Harlequin, as well as they have a wonderful partnership with the with Elevation 24/77 and the dispensary in Nevada City. And our compassion committee and the program through that provides all grown locally, manufactured locally, tested locally, so dispensed at the local retail, fully local supply chain, high CBD, various sort of ratio cannabis products, not just flower, for that patients and anybody with a medical cannabis prescription from their doctor can get completely for free through the dispensary. The concept about what was lost with regulation, with when cannabis was Prop 64 passed, cannabis got commercialized essentially, and commoditized. So the patient access, which is often people who are low income or no income, people who have incredible doctor bills already. These are the cost of cannabis, and I really want to focus on not smokable cannabis in this conversation. There are a wide, amazing variety of cannabis products available to people, whether it is something you want to rub on your skin as a topical, a tincture that you can take, gummies, various edibles, RSO, which is Rick Simpson oil, which is highly beneficial for cancer patients, veterans, all people with all sorts of different physical and just various situations going on for themselves. There's a really wide variety of things, and again, this goes back to consumer education. But our goal is making sure that these products that we know are helping patients and helping just people in general are available, and are available at no cost, actually, because the real catch with Prop 64 and the way that regulations have rolled out is the state of California cannabis industry has outrageously high and convoluted tax structure.
Yes.
And the consumer is who's bearing that burden at the end of the day. The consumer at legal, it's safe legal access, but it comes with a very high tax percentage on it. And so the consumer's paying a lot for that. And that is a really hard thing to sort of grapple with on the state regulatory level. And so our mission is really to make sure that people have access to this, and that price tag is not a barrier to accessing cannabis products that can really help your health and wellness.
That is amazing. And it looks like we're almost out of time, but before we go, I want to make sure that people who want to learn more know how to do so. So if people want to learn more, what can they do?
We have a website, www.nccannabisalliance.org. We have an office here in downtown Nevada City. And I also just want to plug real quick that twice a year, thanks to the wonderful assistance of Valerie, we are so grateful here in Nevada County to have a publication that comes out in the Union, the local newspaper, that's called NorCal Cannabis. There's a fall and a spring issue every year, and it is a wonderful publication and a great opportunity to learn about cannabis businesses, legal cannabis businesses here in Nevada County, as well as just things going on in the industry. There's always a health and wellness aspect to it, and just really great local contributions of writers and so forth. And so thank you for that.
Thanks,
and it's a
Maggie.
wonderful way to keep up to date and just abreast of what's going on in the local industry.
Oh, thank you for that. I appreciate that. I wasn't even going to mention that, but thank you so much.
We're grateful for it.
Well, thank you. I'm grateful
Yes.
for you. It's gratitude all around. So thank you so much for being here with us today and sharing just a small amount of your knowledge about this topic. I wish you nothing but great success in your mission, and I hope that we get a chance to chat again soon.
Thank you so much. It was my pleasure.
Don't go away. Next up, we have Viv Tipton from Hospice of the Foothills coming to join us in the seat next.
Thank you to Stiefel Financial, proudly helping individuals pursue financial goals, businesses and organizations raise and protect capital, and communities offer a higher quality of life. To learn more, visit www.stiefel.com.
This is a story of gumption, perseverance, and damn luck. It starts with this man.
Charles Litton was Einstein brilliant.
He was a genius, made countless contributions to the high technology of his time, vacuum tubes. In 1953, he moved from a young Silicon Valley to Grass Valley, California.
I think that's what happens, right? A lot of us, we found a way to get to Nevada City, Grass Valley, or we found it for the first time, and we don't want to leave.
Soon after, he talked his friend Dr. Donald Hare into starting his engineering business in the same mountain town.
Doc Hare, Grass Valley, I believe came to Grass Valley almost as much for the area as everybody else, but he knew Litton.
Doc Hare and a small cadre of incredibly talented engineers quickly made their mark on a new technology that was captivating the world: television.
Grass Valley knew how to do things with a transistor that previously took a tube.
What came next is decades of innovation, ultimately leading to dozens of spin-offs and related technology companies who themselves made countless world-changing contributions.
How they got to television is this circuitous path of technology that I don't think anyone would ever predict.
The fact that any of this happened at all is technically improbable.
back. Next up on Let's Chat is our guest Viv Tipton from Hospice of the Foothills. Welcome, Viv.
Thank you. Happy to be here.
We're happy to have you here. So, tell us a little bit about Hospice of the Foothills and what you do.
Hospice of the Foothills is our community's nonprofit hospice that has been in our community for 42 years. In fact, we're coming up upon our birthday. It's during fair time.
Oh, geez.
And it was started as an all-volunteer hospice many years ago. And what I get the privilege of doing is having the role of executive director. So in a nutshell, I remove the barriers that our clinical and frontline staff have so that they can continue to give the most comprehensive end-of-life care to our patients in our community.
A lot of people hear the word hospice and it makes them cringe because no one wants to think about the end of life. But there's one thing, two things we're sure of is death and taxes. And so most people just hear that and kind of turn off and put up that wall. Why don't you tell us what hospice is exactly and what services that includes?
Thank you, and thank you for bringing that up because it is. We have this internal thing, and part of it is cultural. Mm-hmm. We don't spend a lot of time talking about the end of life. We don't spend a lot of time planning it, and so inherently, as we approach it, we know it's happening, but we don't have tools and we don't have resources. Mm-hmm. And that really is what hospice care is. It brings in whole person care. And what that means is for your body, and that's we have a physician and we have nurses, and they're going to be able to tell exactly what you need to ease your particular specific symptoms as you travel this journey. Mm-hmm. We have social workers that help with things like choosing a mortuary, what you would like done with your body after, how to do an advanced healthcare directive. For my personal experience, when my father was receiving hospice care, the social workers helped him tell us kids who loved him very much that he needed a little less time with us. So it really is unique. And then we have spiritual care to help people with their existential issues, their spiritual issues. We have aides to support families with bathing. We have volunteers who help patients and their families with respite. It is so unique. And that's what I love about the work that we get to do, is it has to do with the patient and the family in front of us. Yes, there's some themes that thread through, but every patient, every human, every family is different, and we get to figure out what those things are, what those needs are, and then help support them in that.
That's amazing. You said something, spiritual care, and I know that means so many different things for so many different people, and what most people are going to assume is that that's like Christian counseling, which many people do want, but there are people who are outside of that belief system. Do you have counselors that provide other types of spiritual counseling?
Absolutely. Hospice care, because it's designed to be unique, it allows us to identify what those needs are, and our chaplains, and often you'll hear that they're called spiritual care counselors because they're specifically trained in being present for the situation that they're in. So they do not come in with a bend. They don't come in. They have their own faith, but that is not brought into the realm. We also contract out and have networks out in the community to bring Buddhist folks that are learned in Buddhist, just in a range, because we are, as everybody knows, Nevada County is monochromatic at times.
Monochromatic is a great way to put it.
And one of the areas, though, we have incredible spiritual diversity. And so that is something that is part of the process of bringing on folks that are going to come and support our patients, is talking about that diversity in our community and how key that is, because each aspect of the human existence is important to be supported as they travel this road.
Yes, and you talked about respite, and I know what that is, but it's possible that some of the viewers might not. So why don't you explain what that is?
Thank you. Thanks for asking for the clarification. Respite is to provide relief and time away, or even time to go take a nap for the caregivers. Our patients, we provide in-home care, so and the bulk of the care is provided by the family, and there is need to be able to step away and take a breath. And our volunteer, we have a literal army of volunteers who can come in and provide that respite, so the family can take a breath, take a walk, go to the grocery store, and know that their loved one, somebody is sitting with them.
Yes, I know. One of the things that I've heard, like when my father-in-law passed away a few years ago, my mother-in-law finally agreed to have hospice come in and said, "Oh, I should have done this months ago," because she was the sole caregiver for like a year, and it was just a slow. It was very sad. But finally she brought in hospice, and she said, "This has been just so helpful and so wonderful, and I wish I had done this sooner." So at what point is it, when's the best time to reach out to Hospice of the Foothills?
It's a great question. If you're thinking it, you should reach out. Reach out and have a call. There is no harm in calling. There is criteria, and the criteria is a combination of things. It is typically when a patient has 6 months or less prognosis. If their disease should follow its natural progression, they will pass away within 6 months. Sometimes it happens in a week, sometimes it happens in a year. What we're able to do when you call is start the conversation. I would say if you're thinking it, it's time to call. The hospice word is so scary for so many that you'll see across the nation, many hospices are actually changing their name because there's a hesitancy. And what happens is if you come in the last couple of days, you don't get the full complement. The piece that I didn't touch on earlier is that post-death care, the bereavement. What we do here in our community with Hospice of the Foothills, we care for our bereaved families well beyond the passing, but also our bereavement program is available to anybody in the community, whether your loved one was a patient of Hospice of the Foothills or not. Our bereavement is for all. So it really is this expansive package of care that you don't get to utilize all of unless you call soon.
That's wonderful to know. And it sounds like there's a lot of services provided for each patient in a lot of ways. You probably don't call them patients. You probably have another term.
We do to patients' families, because what makes hospice care unique to acute health care is it is built into our policies, our regulation. Our mission is that we take care of the whole family. Our mission is to provide compassionate end-of-life care for our patients, their families, and our community.
I know that anything that we use in the healthcare system tends to come with a heavy copay. What are the costs associated with using hospice? Because that might be something that people would think, oh, I'd reach out, but that sounds very expensive.
Yes, so we do not charge our patients for hospice care.
Wow.
We never have. We do not. That is typical of all hospices across the nation. Anything that is related to the terminal diagnosis, the bereavement post, the groups, the social work, the aides, the volunteers, there is never a cost to the patients.
That's amazing.
It is
That's
amazing.
Really amazing.
And it's done. We're able to say yes in the way that we want to say yes to our community because of the generosity of our community. As a nonprofit, we do fundraise. The money that we receive from payers such as Medicare and private insurance does not cover the care that we provide. Myself, our staff, our board are committed to continuing to provide this very high level of care, this comprehensive care, and we do it because we are a community. that leans in.
That's incredible. And I know that you have a fundraiser coming up. Is that correct? Please
We
tell me about that.
We have Moonlight Magic, which
That sounds lovely.
it shall be lovely, and it'll be at the Center for the Arts on October 14th. Tickets are for sale right now. They just went on sale a couple days ago on August 1st. Antonio is catering it. We've got a woman whose husband was in our care who will be speaking. It's just a great time. It's a great time to connect. Folks often ask me, "Oh, hospice, it's so good you do that, but there's this heaviness wrapped around it." And it is joyful. It is there's a level of honesty and authenticity for those of us who choose to live and work in this world. And Moonlight Magic is going to be all those folks, our community, our donors, folks who have used us, coming together to go, we went through this beautiful part of life together, supporting each other. So you can tell I kind of like what I get to do.
I love that. I whenever somebody is passionate about what they do, it really shines through, and so it definitely shines through with you. And ever since I've met you, I've felt that. So it looks like we are almost out of time, but before we go, I want to make sure that anyone who is interested in donating or volunteering, or most importantly, learning about your services, where can they go to do that?
So the best place to go is to our website, which is at hospiceofthefoothills.org.
Okay.
www.hospiceofthefoothills.org. All of our numbers are there, our thrift store information, how to get a hold of me, anybody that you want to get a hold of, you're going to find through there. And again, I just want to encourage folks, call. You're going to talk to somebody who cares. If you're thinking about it, there's something going on for you, and sometimes it just feels good to talk to somebody else about it.
Well, thank you so much for being here and sharing your passion with us, Viv. Thank you for everything you do in the community, and I really appreciate it. This has been our first episode of Let's Chat. Tune in next time, and we will have 2 more wonderful community leaders in the hot seat. Thank you.